Hello, everybody, and welcome to today's webinar on career options in healthcare informatics. My name is Casey Murphy, and I'm really glad that you decided to join us. We're going to have a very full room, so for those of you who are here live already, congratulations. I'm glad you got a seat. And for those who are watching on demand, thank you for your flexibility. Let's get going. A few little housekeeping items I always like to start with. First of all, I want to let you know this session is being recorded, which I just alluded to, so we'll send you a link to the recording after the session. It usually takes a little while to do all the transcoding and encoding and what have you to get it into a usable format so that you can view it. So it might be later on today, it might be tomorrow, but you will get a recording as well as a copy of the slide deck that Dr. Mack has put together. We'll also have time for Q&A at the end. So you can enter your questions at the chat pane at any time, and we'll save them up and give them to Dr. Mack. Additionally, if you have any questions throughout the presentation, you can go ahead and put them into that chat pane there in the AnyMeeting app. It should be on the left-hand side there, and I'll be monitoring that throughout the presentation. So who is University of San Diego, and why are we giving this webinar? University of San Diego is a nationally preeminent Catholic university known for educating students who are competent, ethical leaders. Those leaders are really committed to the common good, and they're empowered to engage a diverse and changing world. USD is ranked in the top 100 online graduate education programs by U.S. News & World Report and has earned the Ashoka U designation as a Changemaker campus, making us one of only 30 universities to earn this distinction in the nation. Our Hahn School of Nursing and Health Sciences is top ranked in research and clinical practice, and we're super excited to now be offering a number of professional graduate degrees in a convenient online format, including an MS in healthcare informatics. So let me tell you about today's presenter. Dr. Jonathan Mack has 33 years of experience in healthcare, including 20 as a nurse practitioner, plus hospital leadership experience in roles such as administrative director, chief nursing executive, and chief operating officer. He received his PhD in nursing with a research focus on applying systems engineering applications to the healthcare environment. He then completed a 2-year engineering fellowship where he researched and developed clinical user interfaces for medical devices and mobile technology. Since 2007, we've been lucky enough to have Dr. Mack here on the faculty at University of San Diego Hahn School of Nursing and Health Sciences, where he now serves as Associate Clinical Professor and Program Coordinator for the Graduate Program in Healthcare Informatics. So with that, I'm pleased to put myself on mute and pass the microphone over to Dr. Mack.
Thank you for joining our summer webinar series. This month is on opportunities in the healthcare informatics field. We're going to be of occupational health informatics, as well as addressing career opportunities for moving up into leadership structure. So we'll be touching on several things. One is the differences between clinical nursing and healthcare informatics, types of positions that are currently available in the health informatics field. I'm actually going to be sharing with you some recent postings from area organizations. We'll be talking about specific job skills to help you land the job, as well as get promotions within your organization, and then also how to compete for those leadership positions. So you may be asking, well, how are you coming about some of this information and your expertise in understanding this particular topic? Part of my role as program coordinator for our healthcare informatics program, I'm responsible for career development of our enrolled students. So, one of our areas of measuring success, it's not just that students graduate, but that they're out there getting those jobs. So I really look at my role as assisting the student in meeting their occupation. I actually research opportunities and where we're going with emerging roles out in the healthcare informatics field. So I'll be touching and sharing on that as well. Some of the data that I'm sharing today are from published reports from HIMSS, Health Information Management Systems Society, as well as several professional nursing organizations from some of their occupation and hiring trends in the nurse informatics field. So what I want to do for those of you who are looking to actually enter the field, and a nice kind of overview and primer for those who are already in the field, is kind of delineate some of these roles and domain definitions. If you're looking at graduate schools, I always want health informatics has basically become sort of the de facto term for the industry, and many academic programs, including our program, is a health informatics program with a nursing informatics training subspecialty within it. If you're entering the nursing informatics field as a specialty, you obviously have to be a registered nurse in that area, but the medical informatics is now board certification through the American Medical Informatics Association for physicians. But you can enroll in medical informatics graduate programs without having to be a physician. Those are generally embedded in bioinformatics programs. Public health informatics programs, those are specific. Oftentimes they're embedded in graduate degrees in public health programs. Clinical informatics, kind of another general term for health informatics. And we generally will see those embedded in general informatics. And I'm going to touch on the health informatics versus the health information management domain area, because it can be really confusing for some folks. And students in our program who begin looking for jobs, and I encourage you to do that before you graduate, they get a little confused with health information informatics. So just a quick breakdown. As many of you know, the paper-based side of the hospital still exists, even if you have an electronic health record or electronic medical record. Folks employed in the HIMSS area are generally working with paper-based clinical documentation, dictations from, physicians, surgeons, medical providers. That area is still responsible for billing and coding. When you contrast that with the healthcare informatics, the HCI field, HCI field is obviously technology oriented, using computers and information systems to acquire, track, and trend clinical information and data. So I like to differentiate that. And as you're looking at jobs or you're looking at healthcare programs, you want to be careful that you are applying to the right position or right academic job. Now, in terms of a future trend, I think we're going to be seeing these merge. Many healthcare organizations, there's a definite split between these jobs and departments, but as electronic medical records are doing a better job of capturing billing, I think the merging of these roles. So there'll be opportunities across both domains for career transition. I want to touch on the biomedical informatics or biohealth informatics, because that's always a question that I get. Geez, should I pursue a master's degree or a job title that says bioinformatics? Always be kind of careful. The biomedical or bioinformatics generally deals with biologic. For example, individuals that enter these graduate programs are working more in the data analytics side. They may do software programming using software packages like our programming to develop unique databases for capturing genetic or biologic data. So these individuals tend to work in academic and research centers. Sometimes these programs have clinical informatics subspecialty, but these are generally geared towards biologic data, and these are academic research focused folks, but not always. Sometimes you'll find them in the hospital setting. Nursing informatics, just going to touch on that because the majority of our participants today have registered and have indicated that they are nurses. So this is the science and practice that integrates information, knowledge with communication technologies. And nurses, if you really look at them, they're out of the data gathering in the hospital and inpatient settings. And so I really think of them as knowledge workers from the bedside on up. Nursing informatics, we'll touch on those opportunities a little bit later in our discussion, but this is an important career area for development in healthcare informatics. This is a general job outlook and salary by breakdown. Now, this data is about 1.5 years old, and this is from Health Information Management Systems Society, as well as some government data that we've compiled. And this is a national average. So if you're calling from a Midwestern state, sometimes the mean salaries might be slightly lower than when you compare them to East Coast or West Coast salaries for these roles. So this is just an average. For example, the clinical analyst, and these are generally individuals that are coming out of graduate programs, are in the median range of 64,000, but that can actually be higher depending on the occupational setting. For example, if you're hired by a for-profit medical device company, that role might be higher. Tend to be higher here in the West Coast, California area, and I would say that's probably about 75,000. And if you look at the HIMSS data report from 2014 for nurse salary, you'll find that that's actually a bit higher. So always take this data with a grain of salt, because it might be slightly higher, it might be slightly lower, depending on where you're at. But overall, health informatics jobs generally pay better than the average national salary for other graduate prepared or bachelor's prepared types of occupations. This is just a quick little the jobs are and where a nurse is working in terms of the informatics role. So they're primarily in the hospital setting. Now, what's interesting, if you look at the ambulatory care, and some of this data can be skewed because of how the data is collected and how nurses answer this. So ambulatory care could be in a clinic setting with a healthcare setting, but these jobs are growing quite rapidly because of the requirement for healthcare providers, regardless of the setting, to have an electronic medical record. So smaller, medium-sized clinics, physician offices, medical provider offices like nurse midwife practices need these kinds of folks. So this is going to be a growing area. But currently, as of the HIMSS data for 2014, majority of the nurse informaticists are working in the inpatient setting, and our research from the University of San Diego does align with that. Average salary, again, just for information's sake, it's about 100,000 nationally. Again, take this with a little grain of salt, plus or minus, depending on where you're working, and depending on the type of role this is identified with, because this could be slightly skewed with management folks indicating they also have a nurse informatics title. So they generally are a little bit higher on the pay scale. What's driving the demand for health informatics specialists? When we look at information systems in other industries, whether you're looking at auto manufacturing, whether it is for-profit like IBM or Cisco or any of these non-healthcare, information systems have been around for literally 5-6 decades. In healthcare, clinical documentation systems, which mean electronic medical records, electronic health records, have really only been around for a short amount of time. In 2011 is when the federal government started reimbursing healthcare organizations for having a meaningful use certified electronic medical record. So prior to 2009, when Obama signed the HITECH Act into law, full use program, there were really very few organizations that had electronic medical records. They tended to be large health systems like Kaiser. The Veterans Administration has been one of the oldest in the United States with an electronic health record. Some of the other ones, such as Mayo Institute, they've had one for quite a while, but those are ones that have been developed in-house, and they've had in-house expertise to be able to advance those electronic health records. Now, if you go out there, there's literally over several hundred large enterprise electronic health records. So the government has really, with their regulations, has been driving the demand for ideally experienced and trained in clinical background or not an RN. The job market is just as strong for non-RN, non-clinicians as it is for registered nurses in this area. For example, our health informatics program admits both non-nurses and nurses into our program. The average background, generally, they have a business background or they might have some technical, which is a great foundation for entering the healthcare field. So as we're talking through the webinar today, I'm really addressing both the non-nurse and the nurse. But with the expansion of telehealth and telemedicine programs, and the federal government is reimbursing for those, we're now seeing additional opportunities in these areas. And now that the telehealth, telemedicine platforms have gone web-based, that's these healthcare hospitals, for example, to implement telepresence, video conferencing with patients, since if you've got a web-enabled device, which is really your phone, your iPad, your desktop computer, you don't need expensive end-to-end systems like systems. The other end is in a clinic somewhere. Now we can talk to patients at home using inexpensive web-based systems. So these areas are really taking off. So if you're interested in training in those areas, I would look for programs that embed telehealth. And the Meaningful Use program is moving towards a national infrastructure. With so many diverse electronic health records, we're still going to be quite a ways out on connecting clinicians from coast to coast. But that's the long-term goal that the federal government. This will continue to create opportunities out there for both technical individuals on the IT side, as well as individuals who are working on the clinical side, both nurses and non-nurses. It's really kind of exciting, the opportunities that are out there. Now, if you're like me, and part of my job is to keep abreast of industry trends and hiring, because I assist students in identifying job opportunities, I've got to know what the job titles are out there. And you might chuckle to yourself, because if you go online and you do a Google search for health informatics jobs, oftentimes they don't either pop up or they're not popping up with the actual job titles that are being utilized by healthcare organizations. And the job titles really run the gambit. So when you're job hunting, either for a promotion or you're looking to enter the field, you've got to make sure that you're looking across these general areas. And so these common job titles span analyst, they may say EMR trainer. Some organizations use project manager or informaticist, clinical analyst. And if you Google one term, or if you're on a health system website, make sure that you're looking in both the IT department as well as the informatics or clinical analyst or clinical informatics departments. Many health systems, they're not merged, so the job titles are not falling under the same department. But I can't really predict when we're going to see sort of a settling on the. This is not even a full representation of the terms out there. It's really kind of amazing, the job titles. So what I wanted to do first up is take you through a couple of job postings that are recent from national as well as local in the California market. Because the California market does represent well what's going on nationally in terms of some of the job terms. So whether you're interested in moving, you're experienced informaticist, you're looking to do a job hop, or if you're a non-nurse or you're a nurse looking to enter the field, I want to just kind of ground you in the kinds of roles that are out there. So for example, Cedars-Sinai, you might be familiar with them or heard that term. It's a very large nonprofit located out here in California in the Beverly Hills area. This is a posting from July 6th. This is obviously for somebody with information systems experience. This is a manager. But what I wanted to point out is the title Manager Clarity Specialist. Now, see that job title, Manager Clarity Specialist. They use Epic Systems, but this is an individual who's managing opportunities across their organization and a team of 7 individuals and a $2 million budget. So this is a recent posting for them. This is more in line with what we generally see across organizations. Individuals who are on the front lines training or updating the skills for individuals who are working with electronic health or electronic medical records. And the individuals working in this area are not necessarily clinical individuals. In our job market out in California, it's really sort of a 50-50 mix of individuals either with business or engineering backgrounds who have gone into the healthcare setting and achieved some expertise or training, or have been hired right out of healthcare informatics programs with a graduate degree. And this is sort of an entry-level position. And it's a great way as a foundation to move into other specialty areas in healthcare informatics. But you will generally see these EMR trainer positions or EHR trainer positions as requiring a bachelor's degree. And as you can see, this is instructional design, medical informatics, instructional technology. It's quite broad. And I've even seen individuals with undergraduate degrees in business, philosophy, English majors have landed these types of EMR jobs. And it's, you've got to be able to have good communication skills, nice polished presentation in order to get these types of jobs. So we see a lot of these types of positions nationally. They generally refer to EMR trainers. Sometimes they're called analysts, but they're involved in training individuals on the front lines. This is a clinical informaticist posting from the Sharp Health System. Sharp is a 5-hospital system in San Diego. A fairly experienced healthcare system, and they're on their 3rd generation for an electronic health record. So we're very pleased to be able to place our students there. But this is a clinical informaticist position, bachelor's degree in nursing or other healthcare degree. I've seen them hire individuals with undergraduate degrees ranging from English to business. And what they want is good communication skills, an excellent ability to be able to translate technical information for a healthcare workforce. As well as other disciplines that are non-nursing. For those of you who don't have an RN behind your name, there's lots of opportunities for you out there, just as there are for RNs who are looking to transition into these roles. But this job posting, again, is just from last week, and they're still looking. I want to also kind of share with you the workforce out there is actually quite small. Those of you who are already in healthcare informatics roles, you're quite aware of this. So when you see these job postings, when they say, skills required, or they indicate, desired skills, that's really what it is, because the workforce out there is actually quite small. So if you don't have healthcare informatics skills, getting a strong educational foundation on top of your bachelor's to move up into advanced roles, you're going to need that graduate degree. But it shouldn't turn you off from applying positions where you think you might not hit every one of those job areas. Definitely talk to the recruiter, because the workforce that's out there that has training, they're all working out there, as many of you probably are already aware of that. This is with Epic, and I'm sure that most of you, many of you probably either are working in an organization that's using Epic, or you recognize the name. In a national survey that goes on every year, Epic is coming out #1 as the most installed. It's a great product. So we do see job postings across the U.S. This one is in Madison, Wisconsin. Generally, when you get hired in by Epic, and they're known for hiring individuals without technical jobs experience in this area. For example, you could be someone with an undergraduate degree or graduate degree in healthcare informatics without work experience, and they will take you in and grow your career. This particular posting is for a Bachelor of Science in Nursing. And these jobs generally, if you have an AA, you don't have a bachelor's, I definitely would encourage you to get your BSN. But those of you who have a BSN but don't have informatics, Epic will hire you in if you've got some demonstrated technical experience and present well. The caveat to this, just as with Cerner, which is about the 3rd or 4th most installed electronic health record in the United States, they want you to move and then you can work electronically or travel for install jobs. But this is an entry-level clinical project manager position, and you've got to be able to travel with most of these jobs. There are other jobs at Epic, but you generally have to move to their corporate office in Madison, Wisconsin, which is not a bad place to live. I've been there, and it's a wonderful environment. But if you're looking to work for EMR vendors that are large enterprise, and again, that's Epic, that's Cerner, that's Meditech, they want you to relocate to their corporate office for a minimum amount of time. Cerner's in the Midwest in Kansas. I've had quite a few graduates get hired by Cerner. They spend about a year there, and then they can move elsewhere. But that's part of the deal with these larger enterprises. The smaller ones generally will hire you, train you, and let you work electronically and then go out on installs. But this is a great representation of an opportunity for a clinical job that doesn't require previous job history. You're going to have to walk in, though, and have great presentation skills, very polished, and be able to understand and translate technical material for clinicians. And that's the key for nurses, pharmacists, or others, physicians who want information. And, those individuals are typically left brain. Nurses, I'm a nurse, we tend to be more right brain. So, we have good communication skills, we're more human focused, but you've got to be able to have that technical skills part. You've got to think in terms of analytics. So when they're willing to hire nurses that don't have any direct EMR experience prior, they generally have you. I've had several individuals get hired by Epic. You have to go in and actually do a presentation on a technical area, and that's part of your interview. This is a Cerner job posting, and this is for Naples, Florida. But their basic qualifications, and this doesn't require an RN position, just an associate's degree, and this is an application specialist. Now, this requires that you're doing a little more technical piece. Both non-clinicians can easily do this role as well as clinicians. This generally will require a little bit of experience. You can see that the basic qualifications ask for Cerner Millennium experience. And Cerner is one of the EHRs that does have an academic version to get trained on. Our master's program just happens to do that. but this is where if you were able to demonstrate Cerner Millennium knowledge, you'd be able to get hired into this position with an AA degree, and then obviously the preferred experience. But this could be considered an entry level if you go in with a nice polished pitch for this position. But this requires that you move to Naples, Florida. So any of you that are calling in from the East Coast or Florida, this is another recent job postings. And these are very typical of what I see for these large enterprise clinical documentation solutions in terms of I want to direct you, and I'm going to talk a little bit more when we get into the presentation on how to prepare yourself for interviewing or applying for positions. But if you have not looked at LinkedIn for job leads, I would definitely go there. Part of what I require of all of our students that come into our program is they have to post a LinkedIn profile for themselves. And not that it's a disqualifier from jobs, but I think it helps to add that professional piece to your resume if you've got a published profile in LinkedIn. And if you're not familiar with LinkedIn, I would recommend that you take a few minutes and get up to speed on that. They've got wonderful job postings there, probably the most that I've seen. If you're looking in monster.com for jobs, if you're trying to Google positions, this is a great go-to because it spans both the entry-level jobs as well as the upper management and senior leadership positions. And if you're familiar with LinkedIn, you know by having a profile on there, the whole purpose for LinkedIn is to create opportunities for networking. And healthcare organizations use this to be able to recruit. So if you don't have a profile on there, I strongly recommend you put up a professional one. Be careful about what you put up there. It's got to match your resume, but there are quite a few jobs listed as of today, areas, and entry level to experienced positions. And again, I require this of our graduate students to have this posted. And it's really amazing the kinds of job opportunities that students are able to come by because of having this posted. So let me just summarize. There are a lot of opportunities out there. Some of you who might be already in experienced jobs, I always keep an eye out. That's what's nice about having a LinkedIn profile, because I get pinged a lot by recruiters based on posted resumes, as well as students get pinged quite a bit. There's sort of an art to having your LinkedIn profile up there. So it's very important to have a polished presentation that aligns with your resume. It's your marketing tool for the internet. And just about every professional healthcare organization is represented on LinkedIn. And it provides a nice little polished presentation on yourself by having that and maintaining a very current one out there. So in terms of academic preparation, really depends on your background. So for example, if you are dialed in today and you want to get in healthcare informatics, I generally recommend making sure, try to have a bachelor's degree. And if you don't, make sure you've got an associate in those areas. But we're generally seeing a trend towards bachelor's degrees in, if you're a non-clinician, in the business area, analytics. I see them from marketing. And as I've told you, I've seen individuals with English majors, with non-technical, but they have the ability to translate technical information for clinicians. That's a really important skill. Part of our health informatics program, we have a 16-member advisory panel that tells us what industry, and so we constantly update our program on that. And the common theme is the ability, what the demand is for individuals who have good presentation skills, excellent communication skills, that have the ability to understand technical material, be able to translate that for clinicians, If you're looking in specific job areas, obviously it becomes a little more focused. If you're, interested in the analytics area for job and career prospects, that's a big growing area, and it's only going to grow larger. Those individuals need to have Microsoft Access, Oracle, some data mining, data analytics experience. There was a time in not too long ago, 6-7 years ago, when health organizations did not have electronic medical or electronic health records. So the skill set for individuals who were crunching data tended to be a little bit on the lower side because they're using canned programs. And but now with clinical data being locked up in databases, for individuals, for entry-level analysts has jumped up quite a bit. So if you're an individual with a business background, or you're a clinician that wants to move into the analytics and data science area, you'll need to demonstrate a level of competency in basic data management using SQL, and higher level languages, might even be R programming, depending on the type of position that you're going for. And we'll talk a little bit more about that in a moment. But if you don't have electronic health record experience or electronic medical record experience, those two terms are obviously used interchangeably nationally. That's why you're hearing me say EHR or EMR. Try to get that experience, whether you're doing it, you're trying to get into the field, maybe you go and volunteer for a health in the clinical analytics department or the IT department where you're getting some training in that, or you're a clinician and you've already got that clinical experience working with the electronic health record, you can easily roll that into job opportunities, because an end user experience with the EHR is really what organizations want, because you're good, you know how the system works, and if you've got good presentation skills, you can translate the need for the end user. In terms of preparing yourself, you want to be able to prepare yourself at the highest entry level possible. So that's either a bachelor's degree, science degree, or an MSN. It could be an MBA, because there are MBA degrees that have a focus in healthcare informatics. Or you might be an MBA that goes on and gets a certificate in healthcare informatics. We do have that option online through our program. Practical on-the-job experience is the best. So whether that comes by virtue of working in an organization where you're getting that experience, or you're in a healthcare program, informatics program, where you're getting that residency experience, that's key. Most programs don't all, but if you can get that, that's very important. And that looks for an entry-level position when you can demonstrate EHR experience, that really helps you get the foot in the door. Certification, it's not required right now, but I always like to touch on this, as well as professional networking. Many of you probably are logged in and you got the email for this webinar through HIMSS or through your Nursing Informatics Association. Networking is really important. And those of you who are out there and belong to organizations, you know that, because you get job leads that way. Often conferences or chapter meetings with individuals who you may just see the next day at a job interview. And oftentimes, the network opportunities will present future job postings by word of mouth. I always have our students join student memberships through HIMSS, which is Health Information Management Systems Society, or one of the other health informatics professional organizations, because of that networking. And the professional organizations tend to want to help out novice or middle career individuals move up, the food chain, if you will. Professional organization affiliation and certification looks great on your resume. So if you're an entry-level informatics person, you want to get a job, whether you're a nurse or a non-nurse, taking the entry-level certification through HIMSS shows what your level of dedication to and that your knowledge of basic information and systems, that really presents well. Is it required? No. I have yet to see job postings where it's required, although I think in the future we'll probably see that, and that might be part of career organizations for pay raises and such. That's generally how it works in many organizations for clinical ladders. If you're a nurse or a physical therapist, certification is part of that career development. But what it shows to a potential interviewer or HR person who's reviewing your application is it can offset some of the things on your application that may be lacking. It shows your dedication to expanding your knowledge base. So I can't push certifications enough. I think it's important. Is it required? No. Are people getting jobs without it? Absolutely. But I think it's a nice way that'll help get you in the door. LinkedIn profile, I think it's very important. When they ask me, how do I start the job search if I'm looking to move up into other informatics jobs, it had that LinkedIn profile. I happen to know a lot of individuals who do hiring, and they like it when they see someone with a LinkedIn profile because it shows that they're on top of what the technology is out there. And it has a nice way of providing a marketing tool for you because your resume is pretty flat. It's hard to read. Profile on LinkedIn can really make a world of difference where your resume reads pretty flat. Professional organizations that we recommend at the top of the list is HIMSS. For those who are not familiar with it, it stands for Health Information Management Systems Society. In my experience, it's probably the world's largest interdisciplinary health organization. You've got academic folks, you've got vendors, you've got non-clinicians, clinicians in this. You've got individuals across the globe that belong to this. I think they've got wonderful web-based free webinars and resources for educating yourself, lots of networking, and their yearly conference. If you've never been to a health informatics conference and you have the time and the money to go to this, I definitely would go. If you do nothing else but go to the vendor section, really, those of you who have attended are probably smiling because you know how big the vendor section is, and it's a great way to get job leads. I like going to that just to see what's out there in terms of opportunity for our students. AMIA, which is the American Medical Informatics Association, they tend to be a little more academic and research focused, but vendors do belong to that. I think that's a great organization. You can look for cutting edge opportunities in there, and both HIMSS and AMIA will allow you to join as a student, and we have all our graduate students join. HIM allows you to join as a student for free the first year of your academic program, and then the second year is only $30, and AMIA is something similar. But there's lots of networking opportunities that comes from this. And, these professional organizations, they want to help each other out and help the guy up on the next ladder, rung on that ladder. And so I strongly encourage you to join that and display it on your resume. American Health Information Management Association, this is more for people that are in the health information system part. And as you know, that's usually the side of the hospital that is dealing with the billing and the coding and the dictation and the paper side that we still have, and we'll probably still have for a while in health organizations. But these individuals are encompassing the information. They've got great resources. I would definitely think about membership in there depending on where your career falls or spans. And if you're spanning this area as well as the more technical side you might want to think about, if you can afford it or if your job will pay for it, is having membership in both these organizations. The last one I'm showing, and by no means is this a complete list. I apologize if I've left other organizations off, but for your dime and your money, the time that you spend, these are the top ones that I recommend. American Telemedicine Association, ATA, they actually have a free student. You've got to be able to demonstrate through a letter from your program that you're a student. But the American Telemedicine Association has great resources. They have great conferences. If you're building a telemedicine program, and we like to, those of us who are not physicians, we like to call it telehealth. It's a more general and encompassing term. But they've got a lot of documents and program building tools on their website. So I definitely would check it out. And I think we're going to see a lot of great things from the American Telemedicine Association in the future, specifically because the federal government and insurance payers are paying for telecom. Now that Blue Cross is paying for it, although it's limited still, we're going to see it grow. Medi-Cal in California, which is Medicaid, Medicare pays for it. One of the areas that's really taken off with telemedicine and telehealth is psychiatric visits and counseling sessions via conferencing. And now that these are web-based tools that are inexpensive, as I indicated earlier in this presentation, organizations are tapping into these very inexpensive web programs. We actually do have a telemedicine telehealth training module as part of our graduate program. So based on your pocketbook, then I would pick HIMSS and become active. Let's talk about the kinds of roles that are out there. So I showed you some position postings that are sort of general, both for manager, application types of specialists. What I'm going to do is touch on the leadership roles. But before I do that, I want to talk about very briefly in terms of summarizing the kinds of preparation for entry level. If you're trying to target entry-level positions, I definitely would recommend an undergraduate degree, and regardless of what your therapist, a PharmD, you have that bachelor's degree. If you're a non-healthcare person and the opportunities abound for you, don't think if you're not a clinician there aren't opportunities out there, because there are. I would target an undergraduate degree in business, analytics, or information systems. There are business health administration programs with information systems focus. The ideal preparation is to try to get a graduate degree for entry level as well. I'll talk about our master's degree later in the presentation that provides a great foundation for entry level. If you're looking, though, to move up, have a graduate degree, that's very entry level. But for entry level analyst and application specialist, take that time, get that undergraduate degree. Ideally, if you've got an undergraduate degree and you still want to enter the field, then get that Master of Science in Healthcare Informatics. The leadership roles in healthcare informatics, for example, if you're a nurse, you're working out there as an application specialist, you're a clinical informaticist, whatever your job title is, the need for leadership is growing out there, and the job span is growing as well. Large enterprise organizations are starting to open up these senior level positions. We're starting to see opportunities as chief data officers for nonprofits and profit organizations alike. These are individuals that have strong analytics backgrounds with also clinical. But if you're a nurse, you might be looking to move into that next role. Maybe it's a manager role. Or even a CIO role. you've got to have that master's degree. There are some PhD programs out there, but you'll generally see entry-level leadership roles as being at the master's level. So the CIO, Chief Information Officer role, tends to still, in large enterprises, large healthcare systems, tends to be more of a technical role, technical individual. They generally have the IT department. We generally are seeing a bifurcation of these leadership roles, and the departments tend to be separated, not always. Sometimes the clinical informatics roles are reporting up to a CIO, but not always. So you may see a chief medical information officer with nurse analysts, non-clinician clinical analysts reporting up to a CMIO role or a CNIO role. And we're also seeing VP of informatics, and those are both clinician, RN, MD, or non-clinician individuals with extensive informatics background. But these jobs are growing out there for leadership positions. They're very important. There's particular job features for these. You've got to have polished presentation skills, a track record of leadership. It doesn't mean that responsibility. You can demonstrate leadership by leading projects or small group opportunities for project implementation. Those are the best opportunities for you to get that leadership experience. But director or manager role generally requires that you've got several years of experience in some type of informatics role. And both clinician and non-clinician are achieving these roles. What's interesting, and there might be someone out there on our webinar today that's a physician. We do have physicians in our MS program in informatics. There was a day or a time when the chief medical informatics was unpaid, and it was generally it was a techie position from medical staff as somebody that was interested in computers. The organization didn't have an electronic health record, so it was kind of a lot of a symbolic role in terms of very operational. You have to have some formal preparation beyond your clinical. If you're a physician that says, I've got some techie interest, you're going to have to probably go back and get a master's degree in informatics. Not always, but I think the day of not having formal preparation to get to this next level in leadership is quickly drying up. So look at Master of Science degree programs for that entry-level position. I'm going to move on here now. So just to sort of summarize, if you want to experience, or if you want to move into an HCI position with leadership, get the graduate degree. You've got to have excellent communication skills, both written and oral, because you're managing people and you're managing systems. And you can demonstrate that in lower leadership positions. You could be a lead position in an organization that leads projects or small group efforts. And that's a great way to demonstrate a progression of leadership. Track record of success. Professional organization, affiliation, and activity. Oftentimes, the individuals who are making the job selection for these leadership positions also hold positions in large professional organizations. So it always looks great to see that you have professional affiliation, and you might even become aware of these job openings through networking in HIMSS or AMIA or any of the other professional organization. That's a great place to find out about jobs, by the way. Sometimes you'll hear about word of mouth through the networking of the professional organizations before you'll actually see the job posting. emerging roles, I'm just going to kind of summarize here for you. I want to leave enough time for folks that want to be able to ask questions. But in terms of summary, if you're looking to get into the healthcare environment, definitely you need to consider, if you haven't already, an undergraduate degree. If you're considering a Master of Science degree in healthcare informatics, that's wonderful preparation. Well-developed oral and written communications is always very important, whether you are trying to get an entry level or a leadership position. So I caution you, if you put up a LinkedIn profile, make sure somebody proofreads that for you. If you submit a resume, make sure it's the most polished document that you can submit. Oftentimes, resumes, and I've seen this, I've experienced this myself, that resume and that profile represents you. If you've got grammar errors or misspellings, and that happens to all of us, happens to me, that might get your resume pitched in the round file. So be real careful about that. Consider certification and professional organization affiliation and activity. Again, I'm kind of pushing that. You guys are hearing that, I think, loud and clear. If you're a non-clinician, doesn't mean that there aren't job opportunities out there. In fact, oftentimes in organizations, the informatics staff seems to be a little more top-heavy with non-clinician, non-RNs. But the job opportunities are out there for both clinicians, RNs, and non-clinicians. One of the areas for healthcare informatics is the data scientist. If you're an individual who likes data, you're either in a data analyst position in a non-healthcare environment or you're in a healthcare environment, we're going to see a jump in the job opportunities for these individuals. We're seeing lots of discussions around upper leadership positions, view and the management of corporate and enterprise level data, because that's your capital and that's where you're going to make your money. The amount of clinical data that large healthcare organizations have, they're looking at how to monetize that data. So for example, pharmaceutical organizations would love that kind of clinical data for validating post-market data on prescriptions. So we're going to see more opportunities for data scientists. Cybersecurity, I can't say enough about that, and I think everyone out there on this call is probably well aware of that, whether it's from your organization or you're seeing that out in the paper or you've experienced cybersecurity issues with your own personal data. These roles have just taken off, and we do have a track within our MS program in cybersecurity. And then again, the last one for emerging roles is telehealth. Program managers, technical expertise, televideo. If you're looking to move up, I can't stress enough about getting some kind of experience. That helps you get the door opened. So if you're working on a degree with a university college setting, try to get that internship or that residency. That makes a big difference. Coming out with a degree without it, it really shows if you're able to walk in with some level of experience. If you're an experienced individual in the informatics field and you want to take your career to that next level, get that master's degree, join professional organizations, look for opportunities for leadership on small projects to grow your leadership ability so that you have a proven track record of leadership. There are not a lot of individuals out there. Desired. The reality is there's very few people out there with these job skills. So if you've got job skills from another industry, oftentimes that leadership experience will translate to the healthcare environment. So don't discount experience from other industries that you can't translate. If you're a clinician and you've been in a management role leading clinical teams, that's a great way to demonstrate your clinical leadership ability, even though you've been in an informatics analyst role. What I'm going to do is just take a moment and take you through our online Master of Science degree. This is a about 18-month online master's degree that allows you to transition quickly through a Master's of Science in Healthcare Informatics. Whether you're a clinician or non-clinician, this program is appropriate for anyone with that background, or if you're looking to enter the field in healthcare informatics. Each course is 3 units. You transition every 7 weeks into another course. It provides an excellent foundation to enter the field, or if you're an individual that wants to grow your career, the Master of Science degree will provide that foundation for those director, management, and executive level positions. It's 100% online. It's asynchronous, so that means that you're able to do your coursework 24/7 at your convenience. And again, it's the courses progress every 7 weeks with a new 3-unit course. And the program allows you to register in and take the program, begin the program every semester. Our on-ground and our online master's degree are identical in content. The online master's degree was developed out of a need for individuals that are working full-time and don't have the opportunity to enjoy the classroom experience, but still want to earn the master's degree. So the format has been developed for working professionals, and again, it's asynchronous. If you're interested now, there is an application of $45 that will be waived for webinar attendees. The tuition is very reasonable at $925. The next class starts August 30th, and we do have a deadline of August 2nd for the next cohort. Have that cohort filled, so if you're interested in that, please drop a line to us at hciinformatics.sandiego.edu. And if you have any questions, I'm happy to take those via email. But otherwise, I want to thank everyone for joining us on our presentation today. Feel free to email me at hciinformatics.sandiego.edu if you have any questions. Thank you very much and have a good day.